Manuel. How are you doing today?
Good, thank you. How are you?
I'm doing good. My name's Isaiah. I'm going to be your occupational therapist. My goal is to basically just get you back to doing things that you want to do or need to do in your day. How are you feeling today in terms of kind of your COVID symptoms?
Okay, a little bit achy and slightly out of breath sometimes, but overall I'm feeling okay.
Okay, very nice. I'm going to just go ahead and start off. I'm going to take your vitals. Is that okay?
Yes.
All right. So your heart rate, blood pressure, oxygen saturation, respiratory rate looks good. One thing that we're going to focus on that I'll kind of teach you about more is your O2 saturation. I'm going to teach you how to monitor it using a pulse oximeter. We'll put it on your finger and it basically displays a number for you. If it's anything below 100, that's something to be aware of. And then below 90 is going to be kind of our cue to stop activity. And I'll kind of remind you of that throughout the session, okay?
Okay.
We're going to start by preparing you to complete some of your daily activities. To do that, we're going to do some breathing exercises with your lungs, okay?
Okay.
This is going to help to reduce fatigue. It's also going to help to strengthen your lungs back to the point that they were before, okay?
Okay.
The first thing that we're going to do is called diaphragmatic breathing. So essentially what you do is you're going to have one hand on your chest and one hand on your stomach. And when you breathe in, I want you to breathe through your nose, okay? As deep as you can go.
Okay.
But the hand that moves should be the stomach.
Okay.
The chest hand should stay still.
Okay.
Go ahead and give that a try. Breathe in through the nose. And then out through the mouth. Your hand should sink back into your stomach. Next technique that we're going to do is called pursed lip breathing. You can relax your hands on your stomach for this one. For pursed lip breathing, what you're going to do is breathe in for a count of 2 seconds through your nose, and for a count of 4 seconds slowly out of your mouth through pursed lips like this.
Okay.
Alright? I'll go ahead and count for you so you don't have to worry about it, and then you just follow with your breathing.
Okay.
So we'll breathe in, 1, 2, and then out, 1, 2, 3, 4. I'm gonna go ahead and have you sit up in your bed and sit at the edge whenever you feel ready.
Okay.
Now this is where I'm going to show you how to read the pulse oximeter. Go ahead and take a look at it. Your rate is supposed to be at 100%. Right now it dropped slightly to a 94, but that's okay. And as you can see, it's steadily rising back up as you get recovery, okay? So this is something that you can probably take home with you as well. Just monitor your symptoms at home after you do an activity, okay?
Okay.
Alright. From here, I'm going to go ahead and put a gate belt on you. And this is just to keep you stable, just in case anything were to happen when you stand up, okay?
Yeah.
Alright. From here, we're going to have you stand up, and then you can come over to your bedside commode that I have here for you. This is just so you don't have to go all the way to the bathroom, because walking for you right now is very strenuous. So to avoid that, we just have this bedside commode, and it's an easy way for you to use the bathroom. When you stand up, you're going to use your arms so that way you're not putting too much pressure on your legs to push off of the table. And then I want you to lean forward a little bit so that your nose is over toes, and then we'll push up to stand, okay? And then just go ahead and take a deep breath. Okay. Pulse oximeter looks good. Alright, now we're going to come over here to the toilet. Nice. From here, you can pull your pants down, but when you pull your pants down, I don't want you to do it too far because that's going to require bending, which is going to require a lot of energy for you, okay? So you can pull it down to kind of just below your groin area. Okay, now go ahead and you can slowly have a seat. While you're here and while you're doing toileting, in the hospital, you want to make sure that you're wiping from front to back. We're going to get back to a standing position. Do you remember how I taught you to do it?
Yeah, you told me to bring my nose over my toes, take a nice breath in before going, and I can assist with my hands on the handle before I push off.
Yep.
Don't push off my legs.
Yep.
Right now. Yeah.
Good job. Ready? 1, 2, 3. And pull your pants up. And then you can have a seat back on your bed whenever you're ready.
So the next activity we're going to be doing is we're going to be practicing getting you onto the wheelchair, okay, and then moving you over to the sink so you can do your brushing teeth tasks, okay? And throughout that process, I'll be giving you some compensatory strategies to help with your little bit of fatigue, shortness of breath, achiness that you're feeling with the COVID symptoms, okay? That's great. You already have your gate ball on. You're ready to go. Shoes, everything is on. So let's prepare for the standing up. Are you ready? You feeling okay? Yeah? Not too much pain? Okay. I've been told you've been informed with the proper way to stand up off the seat, yeah? Okay, great. So you go ahead and maintain those. And on go, we'll stand up and move toward the wheelchair, okay? Okay. 1, 2, 3, and go. Very nice job. You feeling okay? Yeah. Okay, great. Okay, let's go ahead and walk toward your wheelchair. Watch your step. You feel the wheelchair behind you? Yeah. Okay, great. You can reach back toward the handles and bring your bottom toward the seat. Great. That's great. I like your pace. It was nicely and slow and controlled. It's very good. Let me just put these footrests on for you. All right, ready? Yeah. So I'm just gonna roll you over here. You just stay seated for this task today. And today we'll be using an electric toothbrush. Let me move this slightly out of your way. You can bring your feet off, yeah. Awesome, great. Okay, so we'll be using electric toothbrush, and you have your water right here, toothpaste is right there to your left. If you ever feel like you're getting tired, go ahead and do those breathing techniques, strategies that we've been taught so far. And there's also a cup right here, so if you need to grab some water, just use the sink, use your hand to just fill it with some water, and then bring your cup towards you to lean forward and spit the water out. Okay, so here's your electric toothbrush. You can get going. Let me know. Sorry?
How do I turn it on?
It's just a button right there. You see that button? Yeah.
Turn on and then
Yeah.
place it in my mouth.
Mm-hmm. If you ever feel like you're getting tired, make sure to maintain that breath through your nose. Don't try to hold your breath for too long.
Okay, I want to rinse my brush.
Okay.
Okay.
All
That
done?
felt so easy.
Very good, very good. That's good. That's a good sign. That means you have room to improve very soon. So that was great. You did a great job with brushing your teeth task. For the next task, what we'll be doing is I'll move you over to the table so you can practice some feeding strategies. Okay, so you keep. Great.
So now the next activity we're gonna do is we're gonna learn how you're gonna do your eating. What you're gonna do is before you come to the table, make sure, since your wife is your caregiver and she helps out with the cooking and everything, make sure she assists you to like set up, just to help you conserve energy, so just so you don't have to do all the work. And another thing is make sure that both the food, the plates, and every other thing you need for eating is like close by you, stretch or like reach towards it or anything. Just make sure they're close by you, okay?
Okay.
And then when you're eating, make sure you're seated on either on your wheelchair or on that chair you're sitting on, okay? And then move closer to the table, okay? Can you move closer to the table?
Mm-hmm.
All right. And then if you feel like you're getting weak, you can always support your arms on the table like this while you eat, okay?
Okay.
And another thing is ensure to like take small bites. Don't take like large quantities of food.
Okay.
Just so you don't, because when you take large quantities, you will need much energy or whatever to like chew it up. So just take food in small bites and all.
Okay.
So do you want to practice?
Sure.
All right. So your food is ready, so you can go ahead and start.
Okay. So I should take small scoops.
Yeah, small scoops. how does that feel?
It was good. Yeah.
Easier and
Yeah, taking smaller steps. I didn't get tired as quickly, and I didn't have to worry about breathing in, possibly choking with the smaller steps.
true,
Taking
true,
time.
true. Yeah, yeah. When you take like smaller bites, it helps you chew better, and you don't have to like use up much energy. Then for as far as cleanup is concerned, your wife can complete that, but you can help stack up the plates once you're done eating. Okay, so just stack up the plates, and you can put the this in the plate and stack it up and just leave it like here for her.
Okay.
Okay, very nice. And the final thing to do like after eating is just like to take a break. Okay, and it will help you not just about like helping you save energy, but it will also help with food digestion. And it was a nice day today with all the intervention we did. But before I leave, I'd like us to like go over everything we did from toileting to eating, just to make sure that you still remember. So do you still remember some of the techniques or some of the things we did to help you with energy conservation while preparing for toileting or during toileting?
Yeah. So I was taught of how to breathe with my stomach. So I was told to expand my stomach and then exhale. For standing up, I need to make sure my nose over my toes, not to push. And at the commode, I was instructed to not pull my pants all the way down. For toothbrushing, yeah, I was told to, if I ever need to, I could put my elbows on there, onto the sink. I can have a cup to fill water to drink with the water. I should do it seated for now.
While eating, so what are some of the things you can do?
Make sure I'm still inhaling through my nose while eating, taking smaller bites.
And any pains?
No, it's just like my light to moderate light.
Well, I'll let the nurse know that you're on your chair, okay?
Okay.
So I'll see you tomorrow.
Okay.
Bye-bye.
Thank you.